Healthcare is one of the most critical public services, directly affecting the lives of millions across the UK. The NHS is one of the largest organisations in Britain, spending over £100 billion a year and treating over 40,000 patients a day. And those numbers are set to rise in the coming years, making healthcare perhaps the greatest national priority. Today's healthcare sector is facing challenges, but it's a vibrant and dynamic industry committed to delivering better, faster, more cost-effective treatment. Over the next half hour, we'll be discussing the future of the healthcare industry with some of the UK's leading innovators.
Healthcare in the UK today is more prevalent than ever. End users, i.e. a patient, is more demanding, so they have to have very robust systems behind that to back up that patient care. NHS England will look at studies to reduce heart attacks in the East Midlands. How are they doing that? They're doing that through data mining. Healthcare really has numerous jobs, if you like, within the community. One is obviously the health of the UK, but second is how can we improve that health in the UK on a long-term basis.
We believe that new technologies have a really important role to play to help support fundamental service redesign. We're aware virtually every day in the media the pressures that the NHS and health services are under around the world because of an increasing demand driven largely by an ageing population and increasing propensity for long-term conditions, obesity, diabetes, heart failure, respiratory disease. Mobile solutions have a really important role to play for the care of people within their own home and their own lifestyles. One of the reasons we decided with our Safe Mobile Care solution, for example, to use a smartphone is that it's a familiar, everyday device that nearly every person in the population owns, uses.
Patients arriving in ambulances are frequently taken to hospital because there is no other way of treating them at the moment. The use of technology does allow that to be improved, so you can do more what's known as see and treat at home. So for example, if you go to a patient that's fallen over, they might have complained of some chest pain, the paramedic can do an ECG, send that into the hospital, the cardiologist can look at the actual ECG and decide whether the patient needs to be admitted. So you can avoid the number of transfers into hospital inappropriately. But also it means that patients can be looked after at home after being seen initially by the paramedics. So it does improve the efficiency of the ambulance service.
IT is widely used within the healthcare market. If you look at the IT within the entire of the UK NHS, it's very different from one trust to the next. A lot of the time, the software that they use, the hardware that they use can be vastly different between hospital, and those hospitals might actually be geographically next to each other because they've all got their own budgets, they've all got their own management, and they all like to do things in their own specific ways, even though the end result is the same, to deliver great patient care. So there's a few challenges with regards to the integration that they could improve on if they were more collaborative talking, which they are now starting to do. One of the key features of the NHS and working with patient data is keeping that data secure. There has been a movement towards putting data in more of a local cloud, so making the devices as thin client as possible. But that's not always possible, whether you're talking outside in the community or in an ambulance. There's always inherently going to be some data on that system. So data security is a very large issue, especially with the new data protection laws coming into play shortly. So having a product that really, and a solution that can really be designed to alleviate those issues at various levels to whatever the trust or customer needs them to be at is key to be able to be considered in this world.
Funding is perhaps the greatest issue facing the healthcare service today.
The healthcare in the UK is massively open to innovation. They have budget constraints, so they have to do more with less. And because of that, it's driving them to be very pragmatic and also nicely innovative as well.
The whole NHS has changed immensely over the past 3 or 4 years. We've seen lots of emphasis on reducing costs, delivering better patient care. And so as a result of that, what we're being asked to do now is really look at how we use technology to deliver a better patient outcome, but also how we integrate systems across the healthcare providers so that we are effectively capturing data once and using it lots of times rather than continually rekeying that data in.
The ageing population has led to ever-increasing numbers of patients with less funding available to treat them, placing significant pressure on all healthcare providers. Building a health service that can keep on delivering world-class care to ever more people while spending less to do it is a huge challenge.
So the big challenges of the healthcare sector is really getting more for less. Since the financial crisis of 2000-2008, obviously we've been going through austerity. So the healthcare systems have been up against it budget-wise. However, we found that they've managed to look at that in a really pragmatic way and have said, right, we have an aged IT system. What is the best thing I can do with that budget, and how can I improve the end user experience? How can I improve any usefulness of the data, i.e. data mining for research and studies? So it's very, very interesting at the moment.
We have numerous IT challenges across the organisation at the moment, across Chesterfield Royal Hospital. So we've spent the last 3 years modernising our entire IT infrastructure. So we were working on some quite major end user application projects to try and make information more accessible to our clinicians and to our nurses. But because the infrastructure wasn't really at a point where it needed to be to support that, we realised that we weren't going to get the benefits out of the the investment that we were making in the digital transformation and the applications and such like. So we've spent the last 3 years basically moving our infrastructure from an obsolescence position into what we see as a leading edge platform and something that's capable of taking the digital transformation that we're obviously looking to implement. We're trying to change the way that we deliver care to patients. So historically, you've gone into either a hospital or into a GP practice and you've had care delivered in that setting. The whole ethos at the moment is to try and change the way that we deliver care, so to make it far more community-based and to make it a care that can be delivered in any part of the NHS, whether it's within your local hospital, within your GP practice, within a community hospital. And so from a patient record perspective and making that information available across all of those settings, the digital agenda is highly important. Without the IT to support that, we'll never get to that vision. So one of the key bits of work that we're doing at the moment is making sure that the information that we have that supports patient care is available to everybody who's involved in that patient's care.
The healthcare sector has massive challenges in terms of resource utilisation. We believe in Convolt that one of the things that we can do is make better use of the data that is being collected to make more effective clinical decisions that in turn will maximise the use of the revenue that is available to healthcare organisations. So the real challenge is, how do we change the way that we practice medicine? How do we change society's use of our healthcare organisations and make sure that you are only really attending, as an example, in an A&E department when it is absolutely necessary? Are we maximising the resources that we have, and are we making best use of the information that is available to us to make more informed clinical decisions?
Being able to deploy a highly available, resilient, rugged technology platform in the back of an ambulance has lots of challenges. One of the reasons we opted for the GTAC ruggedized tablets was because when we evaluated the products around, it came out as the preferred model that we wanted to deploy. We're looking to use that though as a springboard for a lot of other clinical developments that mean we can become far more mobile as a workforce.
The main requirement for a medical device is the ability to be used in an environment that has very little germs or needs to be cleaned regularly, or indeed not interfere with very sensitive equipment such as heart rate monitoring equipment. And so to have a computing device in those environments, it needs to have certain design characteristics. It needs to be able to be cleaned regularly and without having problems with being cleaned regularly. So obviously if you clean something every day with abrasive sort of liquids, then you don't want the products to deteriorate. So they're the things that really go into making a medical device.
Actually being able to deliver technology that works from the back of an ambulance that our crews can just use with confidence is a challenge, but it's one that's working. It's working well so far. Time scale was probably our most significant challenge during the implementation of this programme. We found ourselves in a position where we had a deadline by which we had to implement, which had been provided to us by the Department of Health, and a very late start date. So effectively we had to throw a lot of effort and a lot of resource into a very small window to deliver the project. That was a whole team effort. Providers, suppliers, software, hardware, my own internal team, all came together to give us that great product in a really condensed window. So other than that, I think probably the only other real problem that we came up against were the day-to-day logistics of actually getting the devices built, deployed, getting vehicles off the road, logistically being able to pull vehicles off the road to do vehicle fits, to accept the new hardware. Obviously that has an impact on us being able to deliver patient care as well. So scheduling that with our fleet department was probably the biggest challenge, I would say.
There are major challenges for all healthcare organisations around their existing IT systems. Many legacy systems have been around for a long time. A lot of them are running on old-fashioned technology. They are applications that were fit for purpose in the 1990s. They are applications that are very rigid in their design, and they invariably stand alone and are in reality creating a silo of information.
Yeah, the NHS is one of the biggest IT users in the country. The main issue is keeping them current to make the best benefits of new technologies that come out, rather than staying on a platform for many, many years that potentially can give them a few issues. Recently there was a well-documented ransomware issue that some of the NHS had problems with, and it's literally just because they haven't upgraded, they haven't updated to various levels of security patches they could do. So they certainly adopt technology, but it's keeping them fresh, keeping them at the leading edge of technology, which could help benefit them. That's one of the challenges they have. The NHS currently faces big challenges regarding budgets, regarding user adoption of technology, and just to explain that, technology is massively integrated within the NHS, but leaps of technology that are already available, to integrate those into the NHS is difficult because not everybody in the NHS from a user point of view is IT savvy, so they want things to be as quick, simple and easy as possible. So the challenges really are getting that integration of the benefits of technology to be used in a day-to-day basis to improve patient care.
New technologies have brought substantial efficiencies to almost every industry over the past decade. The arrival of integrated, interconnected IT systems has been the catalyst for wide-scale transformations across our economy. Now, these same innovations are beginning to arrive in the healthcare industry, bringing major benefits for both doctors and patients. Immediate access to information has the potential to ensure that clinicians always deliver the right care, as well as allowing patients to be more empowered and better informed.
I think decision making for doctors based on data are very important. Ideally, you want it before the patient deteriorates, because then you can intervene at an earlier stage and prevent any further deterioration and avoid a hospital admission. And that's the advantage of using telehealth such as Safe Mobile Care, where the patient is continually monitoring and algorithms on the back end detect any slight change so that healthcare giver can intervene at an earlier stage than normally happens. The normal progress of this is the patient deteriorates to the point where they have to be admitted to hospital. It is important when adopting technology that you don't suddenly deliver vast amounts of data to an overburdened health system, so-called data drowning. Now, the great thing about our solutions is that they only issue alerts if the patient's condition has deteriorated. So the doctor only actually sees those patients where the condition started to deteriorate. He can obviously access all the other data, but he only will see the data that he needs to see for the patient to be seen in an emergency situation or a deteriorating situation. The NHS has conducted a survey on our deployments, and one of the surveys showed that there's a high degree, greater than 85% patient satisfaction. And that was on several parameters, such as security, learning more about their disease, being happy that they've avoided hospital admissions, and it allows them to live more independently. But most important, a lot of them found it very useful from empowering them to make better clinical decisions, so they became more empowered and engaged in the management of their condition, which is something that all patients should achieve. Paramedics collect various types of data. They collect, first of all, messages from the control center as to where the patient is, what the outline of their condition is, and what the urgency of the need to see the patient is. Once they arrive at the scene, then they start to collect vital sign data from third-party equipment, such as an ECG or blood pressure or pulse. And then they also collect individual descriptions of the patient's complaint, what past medical history is of relevance, and what medications they're on. And all this data can be sent ahead of the patient arriving in the hospital, so the hospital team are fully informed, and that allows a much faster handover between the ambulance team and the doctors in the A&E department. And handover time is crucial to prevent, if you like, a traffic build-up of ambulances outside the A&Es, which you sometimes see on the news, especially during the winter months. So having collated the data at the place of incident and transmitting it to the hospital means that the A&E staff can be better prepared, but also it means that the patient can get faster treatment because the handover is far more efficient.
So paperless working from a clinician's perspective means that they have all of the information that they need when they see a patient to hand quickly and easily. So some great examples of where that holds us back when we use paper records. Paper records are a physical item. It's in one place at one time. If it's not where we think it is, so we have a records tracking system that shows us where, well, it's supposed to show us where every set of patient case notes is. You know, there's a high degree of error in that system because people don't track things. They don't follow the processes that are in place for them to keep that up to date. So, you know, if a patient arrives at an outpatient clinic and we're unable to find that set of paper notes, that can have a direct impact on that clinician's ability to deliver care. It can have a direct impact on the clinician's ability to keep the patient appointment to time, and it obviously hampers his ability to record the content of that particular consultation as well. So digitising records obviously means that you've got those records to hand all the time. You know, the contemporaneous notes, which are basically the notes that are taken at the time that the patient's seen, are available to other clinicians straight away. They don't get lost, so it's easier for the clinicians to then summarise and to obviously do whatever correspondence they need to do after they've seen the patient. So, you know, it's about making those records accessible at the point of care straight away without delay.
The electronic patient record system that we've implemented, what it allows us to do, we can capture the information electronically whilst we're with the patient, and we can forward that information on to the hospital that we're going to. Or if we're not going to hospital, we can automatically send a summary discharge letter to the patient's GP automatically, so that the GP knows that we were called, knows the treatment we gave. But in the case where we actually convey a patient to hospital, the receiving clinicians can see what the patient is coming into them with, what their conditions are, and so they're better enabled to be ready to continue the treatment once we arrive. We've only recently deployed this iteration of our patient reporting solution, so the measurable gains for us as a trust as yet are quite small, but typically what we're able to start recording is the benefit to the patient in us being able to signpost to alternative services rather than taking them into hospital automatically. That obviously converts into cash savings elsewhere within the healthcare system. But also for our clinicians, they're more able to deal face-to-face with the patient because they haven't got to spend as much time typing the information into the system because that's been populated automatically. So they get a better patient experience in the face-to-face instance.
If a doctor at patient side or a doctor on a ward round when they're walking around visiting the patients on a ward, if they've got the information readily available to them about that patient, about their condition, the updates that the nurses have done every hour or every 2 hours, whatever the period might be, they get real-time data so they can give real-time analysis and real-time diagnosis of what may or may not be occurring. It just makes their lives a lot simpler from a doctor point of view, but the patient is going to experience a much better interaction with the staff in the hospital and put them more at ease. For the NHS to really be paperless by 2020, which is the government guideline, then there is still some way to go. I think the devices they're using, the software they're using needs to be more modernised, it needs to be more tablet focused, so it makes the interaction with that device or software much simpler for the users, because the NHS has got such a broad range of employees from 17, 18-year-olds all the way up the scale to middle age and beyond. Therefore, not everybody is at the same IT level, so that needs to be simple. Once that happens and those devices and the software are combined to give the user a great experience, I think that will then massively aid getting paperless. That's one of the biggest probably hindrances for achieving that. But the main areas that, patient records, things like that, that's already starting to happen, and they've made massive advances in that area already. So I think in certain areas it will be, absolutely. There's some way to go with some software interactions with the actual staff to be able to get it fully paperless.
In the coming years, healthcare will remain a major priority in the UK. Challenges must be met head-on and overcome using smarter approaches and more efficient working. With another decade of investment, new technologies will come to change the face of the entire industry, potentially even changing our idea of what a trip to the doctor looks like. The only certainty in healthcare is that patients will always remain the focus of all efforts, the single goal being to provide world-leading care to as many people as possible.
So the future of healthcare is going to be driven by digitisation. It's going to be the always-on society. So when an end user walks in and the moment that their details are captured on the system, it's digitised. The x-rays will all be digitised, so that hopefully we will get a robust system that you will have a central source. So the digitisation is massively important for that. Also, when you move away from paper and pen or archival files in paper stores, etc., you're able to do a lot more with the data. You're able to search it and data mine, so you can look for trends in healthcare. You can look for, have there been more heart attacks in the East Midlands than in the West Midlands, for example. You cannot do that without digitisation. So digitisation is massive for the future of healthcare, and Culspray and Commvault can provide those solutions that will give you the end user experience of never losing a file, through to compliance, through to the data mining.
I think for the NHS not to invest in technology would be a big mistake, and we're setting ourselves up for failure, because we know that by the sensible use of technology, the patients can use it without any particular problem, B, it improves efficiency dramatically and will allow us to provide a bespoke, patient-centric, fit-for-service NHS for generations to come. If we continue down the road that we're heading at the moment using traditional models of care, the NHS will fail. I think in the next few years we're going to see a lot more use of machine learning and artificial intelligence. We started using artificial intelligence around about 2006. At that stage it was not acceptable to use computers for diagnoses, but we had diagnoses being made by mobile phones for heart and lung conditions that were far better than consultants. But at that time it wasn't pursued because it was unacceptable. The work that's being done now has shown significant advantages of using AI, because it allows doctors to concentrate on the cases that they need to concentrate, as opposed to just purely diagnosing a numbers game. So I think machine learning, AI is going to be a huge step forward, but once again it has to be directed at a particular problem, as opposed to a broad brush approach that some of the big organisations are using at the moment, which I think is inappropriate. There's also a trust element of this, because I think it's important that there is trust between the patient, the doctor and the provider of the AI, and sometimes that trust has been betrayed due to data leakage, etc. And I think we have to understand that if we are going to use technology, there has to be the same professional trust that exists between the patient and the doctor at the moment, but between the patient, the doctor and the technology firm in the future. Technology is just an extension of medical professionalism, and that has to be held at the highest level. We should not commercialise patient treatment. And I think this is the problem with some of the firms getting involved. They're coming from the commercial arena and don't really understand the professional ethics that exist. One of the things that we've always held proud in our company is the fact that we come from a medical background and understand the professionalism and the ethics of treating patients and how vulnerable patients can be. And they're not just a series of codes, they're actually a patient at the end of the day. They might generate data, but at the end of the day, it's important that we maintain that trust in a professional way and execute the delivery of healthcare in a traditional method, but using new technology.